Thank you very much. Before we move on, I just wanted to dig down on a very specific point around ethnicity and culture and women's pain. Big fan of Nigat's work as well. If anybody is watching and doesn't know Nigat, please follow her on social media. She is a wealth of knowledge. But I wanted to talk about particularly trust. Dame Lesley, you talked about trust, and that's really important, particularly when it comes to FGM. And it is something that I am seeing increasingly in my inbox, and I know is happening still in the UK, as well as women being taken to other countries for that to happen. And the trust element is so important, and I wondered how it is that you are able to gain that trust, particularly with women that are of child-rearing age, of 25 to 32, who have been subjected to FGM, usually by a family member as well.
Well, I remember when I was a very junior consultant and I first went to St Mary's as part of the Imperial Group, I was the only woman consultant, obstetrician and gynaecologist, which in itself is a bit of an oxymoron, isn't it, these days? But the reality was I couldn't understand why I kept seeing all these young women from the East and from the Middle East who were coming to see me who had never been able to disclose before that they had had FGM. And the very striking thing, come back to your point about trust, was it wasn't the physical act that distressed them so much, and it wasn't even the fact that this was part of a male culture imposition. It was the fact that their mum or their auntie or their big sister had been complicit in this. And they told me, and I've got no reason to disbelieve them, that that was the thing that haunted them most, and that they couldn't understand why another woman would do this willingly to somebody. And so I think that, recognising that I don't understand all of the cultural mores, if you like, and asking people to please help and inform me with what I need to know about what they feel about something or where they're coming from, so that I can appreciate their position, I think is most of the solution to this.
And at a more kind of patient-facing level, Dr. Mann, what do you think needs to be done? Is there more work that needs to be done, particularly in this area? Because we heard a lot about FGM, say, 5-10 years ago, and it seems that, people seem to stop talking about it quite so much. And actually, from what I'm seeing, from the reflections from communities, actually, the problem is very much still there. And it's a problem when they disclose, even if they speak to their GP. Even one woman was told that it was just cosmetic work and to see a plastic surgeon. So I'm wondering if there is more work that needs to be done on that level.
Absolutely, and I think the trust has been eroded, and I think part of it is understanding what we need to do from the communities that we're serving and working closely with voluntary sector to know what that might be. But I think we have a responsibility as clinicians as well when we see people in clinic. So often we'll do a gynecological examination, and it is the one opportunity to actually recognise FGM and then initiate a conversation. So I think we have a sort of opportunistic kind of duty to do that. And women experience awful things apart from the trauma of the actual procedure. They have urinary problems, they have sexual difficulties, all sorts of pain, infections. So to give people the opportunity to have that conversation and then decide for themselves, it's a choice. And I've seen quite a few people who've said, no, thank you, I'm absolutely fine. And I might look and examine them and think, gosh, that surprises me. But I think even having that first conversation and then following it up, because after that we have got specialist clinics, but if people aren't using them, then we're not getting it right. So I think that's really our duty.